Vasun is not able to present, and I think we can all forgive her for her delicate condition at the moment. We don't want to hurry that up. So instead, Abdul Hafiz Baig is stepping in for us to discuss the abstract. What factors determine healthcare professionals' acceptance of mobile devices for telehealth? A qualitative study conducted in Queensland, Australia. So please welcome Abdul to the stage.
Very good afternoon. I better supposed to stay here. I'm not a person who can stay one place. You can tell that because I teach, and it's very hard for me to just stay on one place while I teach. I just can't think about anything. I just have to move, and I'll do my best to stay here if I can. Thank you very much. I think the world is very exciting. I've seen a lot of presentations, and people are talking about telehealth all the time. And I believe few people have missed the train already in this domain. We have seen telehealth. There is very obvious advantages. You have seen it from various presentations. The potential of the telehealth, the limit is the sky, and we're not there yet at all. And one of the things you must have seen over and over, I've noticed a lot of speakers have been talking about, we really need to know how to use it. We're not really sure about it. They've done a small scale study, ad hoc study. They come up with some sort of findings and advantages. Yes, that's great. It tells us the potential. But at the end of the day, almost every speaker is talking about, we really need to know a bit more than that. There are some issues, how to use it, and some other limitations in the problem people are using it. In academic terms, we call it adoption. So I just thought adoption is an important component, especially an adoption is an important component in a healthcare environment. Remember, healthcare environment, the health professionals are trying to save lives. The trial and error cannot work. Thanks to the technology, we all use different tachos, we use all the smartphones, we use technology, we are surrounded by all different type of technology. We're quite savvy in that respect, but still, we could afford to do an error outside the healthcare environment, but not inside the healthcare environment. So one of the solution, one of the answer to these type of issues is how do we actually adopt the technology, and especially healthcare scenario. And that's the study is all about. It's a PhD study. It's my student up sitting there. She's doing a PhD in this domain, and it's just the first part, the first phase of the study is a qualitative study. We're going to present very few findings of that qualitative study in terms of adoption. Kindly feel free to ask me a question anytime. I'm happy to talk about it. If it moves, otherwise I can just, will it move? Is it supposed to move? Oh yeah. There is just an outline here, and the important part of this is that you look at this first part, the background here is that I wish the technology is such a way, why can't I get the health, whatever the services I want while I'm sitting on a beach? Why can't I get these health services wherever I want it, whenever I want it, and whichever way I want it? I think that's an important component, that's an important part, need to be answered for tomorrow's. And we are heading towards that. I have no doubt at all. It is going to be time that if you look back behind it, there are so many things in our life we actually have achieved. We are going into that direction. It is our world. It is my requirement or your requirement. You want healthcare services. What you want, where you want, who you want, you should have a choice. especially healthcare professionals are renowned to be overworked. They have late shifts, long hours. Why can't they live a normal life as well, like other people, 9 to 5? I think the technology has the answer to those questions. And I'm very hopeful we're heading towards that direction as well. So in this scenario where we see the healthcare budget is problem, the number of beds are problem, the number of resources are a problem, in all terms, we see there is a lot of issues there. And everybody start talking about how can the technology can help. And we have seen many presentations, right? They're trying to present different type of scenarios where the technology can facilitate. And everybody has proven through their ad hoc studies or small studies that there are considerable advantages you can achieve if you use the technology. But the important question is, you use the technology or you adopt the technology appropriately so that you can get the full benefit, best possible way in a healthcare environment. So I don't need to repeat this, what healthcare scenario is at the moment in the healthcare industry in the Australian environment. You're well aware of that, what sort of issues they're eyeing, what sort of limitation they're going, right? So I can just skip that little part there. So what we thought, and this particular study, trying to understand the adoption of a technology, right? And we can talk wireless handheld technology, we can talk smart technology, we can talk mobile technology. People talk about different, people talk about iPad, people talk about this. They're all same, they all have their own place in this environment. So that was the one objective to how can, because we could see through that how the migration of the technology is happening from one end of the scale to another end of the scale. So the research question drafted for this, this research question was drafted, of course, through the literature review, the gap was identified, and then research question which is being crafted for this particular study is, what factor determined the healthcare professionals' acceptance of mobile devices for a telehealth environment? The important component here is a mobile devices. Another important component is for the telehealth environment. Another important component is in the healthcare environment. So these are the three pillars of this particular, these are the scope of the study, that where the data will be collected, where the information. Even though the study is going to be conducted in the healthcare environment, this study has a lot of implication to the wider scale of different domains as well. So it is, in an academia, it is very important that any long-scale study you do, there is some theoretical background behind it. There is a lot of research has been done, adoption done early 40s, 30s, 60s, 70s, 80s. There's a lot of theories there which adopted. People have been using it, people have been talking about it. Any academic paper you will read, they will talk about some adoption theories. And in this particular domain, we have identified two basically theoretical parts, and one is a TPB technology, and the other one is here I can show you this one. This makes a bit more sense here. It's a theory of planned behavior, and the other one is a Rogers theory of division and innovation. We believe these two theories have the answer to the adoption phenomena of the telehealth environment for the mobile devices. This theory, remember, in this particular study, we're looking at on individual level. There are two ways of looking at it: organizational level adoption or an individual level. This study is talking about an individual level, and these two theoretical studies actually provide a good background and theoretical background to conduct these studies. We adopted methodology. Quite often we have a methodology. A lot of people adopt a quantitative methodology or a qualitative methodology, but we decided to go with a mixed mode methodology. There is a reason behind it. We believe it is in the healthcare domain, in the telehealth environment, it is an exploratory study. It is important to go to the real user. It is important to talk to the real user and ask them the real question. If you adopt one, like for example, quite often you see the different theories of research, they adopt a survey technique or a questionnaire instrument technique and try to collect the data from 200, 400, 500 people and try to get some results out of it, right? Make some sense out of it. I have no objection to that, but we believe this is an exploratory study. There is still a lot need to be explored in it before we can go to a mature stage. That is why we decided to go for a mixed mode methodology. The qualitative study part is the focus group, which has already been conducted. The focus group was conducted through different healthcare facilities, and we spoke to the real people who are directly involved in the telehealth environment. So to have their views, right, how they perceive the technology, what the issues they look at in the context of adoption. Why we have the quantitative approach? Once we have the qualitative approach, we have the qualitative data. That data will be analyzed. On that data, the basic, the theoretical framework which I have identified will be refined further in the context of the telehealth environment, in a healthcare environment. And then once the framework has been refined further, we will go out to the wider society to see the views of the wider society, how they perceive the specifically developed framework for the telehealth environment for the sake of an adoption for mobile devices. So that is the logic behind the two-stage approach. I better get to the finding. And so here it tells you clearly that basically we have a qualitative approach, then we have quantitative approach. In both that, we are expecting that there will be a lot of new factors, new determinant will be identified, and then there will be few new one maybe come along, and a few maybe not be the generally perception of the people or the healthcare profession there. The qualitative data was analyzed. The qualitative data was again, the analysis of a qualitative data is very important. In today's, it is very important to use an application. There are many software available, and you put some your information in it, and you just mix it like a grinder, and something comes out. That is not the way to go it. The traditional way, how we used to analyze the data manually, still very, very important. Even though you have a software, there are many software available which are able to analyze the qualitative data and able to provide you themes, and able to provide you some percentages and graphs and all those things. But we believe that whatever you do, manual analysis of your qualitative data, and then you affirm that through the software different way. So we did double the work. The whole data was analyzed manually. Manually, the factor was identified from each focus group. Then manually, all those determined was converted into themes, and they were consulted with the healthcare professional backward and forward. And on that basis, we determined there were basically 4 themes was coming out. There is a human environment theme, there's a mobile devices aspect, there's an organizational environment, and the individual aspects as well. So these 4 themes came out from the qualitative study. So what going to happen from onward? From this qualitative study, of course, there are a lot of factors and were found from the focus group. All those focus group among these themes will be converted into a questionnaire. And I believe Vasu has already given you the questionnaires. They are actually, those questions are developed for this particular study from the focus group. That is why I said it is an exploratory study. We went straight to the user, we talked to them, we asked their views, we identified those, and the questionnaire, which we have already developed that, and I would really appreciate sometime you guys can fill that one as well. That will be appreciated. So that has been developed from that. qualitative study as well. So if I go a little bit further, just to share a little bit, for example, under human environment, people talk about social influences. There was some contradictory statement coming along. That's all right. Certain people can contradict, but we have to present both sides of the coins there. But through the quantitative study, we'll streamline that what side of the coin actually exists and what is the value and what is the causal effect of that, what is the percentage effect of whatever you tell, because we intend to run some on quantitative data, some sort of a structural locational modeling and regression modeling, which will actually give us some sort of causal effect of various determinants and the factors we will have identified in this form. So here's just an example of what people said in the term statements. These are two people's statements straight from the focus group. I've been told I should finish now. So this is a second theme, right? Mobile devices aspects. Again, as you have heard over and over, people talk about connectivity, people talk about complexity, people talk about training. Some people says, yes, we need a training. Some people say we don't need a training. There was very clearly the technological issues were coming up from very previous presentations. So we are finding that. But at the same time, you notice that these are the things people are talking as well, which has already been identified, some other studies as well. Remember, it's a large-scale study. It's not ad hoc or a small-scale study. It's a 3-year-long study, please. The next theme is an organizational environment, right? And then people in this particular theme, we were talking about training, management support, and resource issues there. That, again, there is a clear-cut statement from one of the focus group. It identifies. There are many statements like that. We didn't want to produce that. So that is, if you still go back, you think about our methodology, going back to the user, doing an exploratory research in the first phase, talking to the people, getting it out, what is real. Literature tells a lot of things, but literature tells us in all other domains, right? There's a lot of domains in the healthcare. We want it in the telehealth domain. So this will be the large-scale study specifically devoted to the telehealth environment, and it will provide a framework. At the end of the day, it will actually develop a framework which can be used to adopt the mobile technology in the telehealth environment. That is the conclusion of this particular study, by the way. So this is another theme. I can just skip that. This is the initial framework. This is the 4th or 5th phase of the framework. This framework was initially developed from the literature, and it has been revived and revived over and over through the different sources. And then you see all the crazy relationship going on. The quantitative data will actually determine how strong these relationships exist, what directional level, what causal level these relationships exist. Are they positively, negatively, and certain relationship will not exist at all. Until now, through the focus group and through the qualitative data, this is what's the relationship coming up. But it will be refined further after the quantitative study. Here are the benefits. You have heard about a lot of benefit about telehealth environment. I don't need to go over and over. Of course, if we do adopt properly, there are benefits itself as well. Thank you. I would once again like to request if you can kindly take a few minutes of your time, please. If you can fill out the questionnaire, please. We will really appreciate that. It will help the student. Thank you.